Do you have problems sleeping? Well, you are not alone. Millions of Americans are sleep deprived, and that can cause fatigue and emotional distress. Here to explain what might be causing this, Dr. Mark Buchfuhrer. Good morning to you.
Good morning.
Why do you think millions of Americans are not getting a good night's sleep?
Well, it's a hard question to answer, but there's many things mostly related to society and our schedules and watching TV with bright lights that has really screwed up our natural ability to fall asleep. And because of that, millions of Americans are suffering from insomnia. And of course, as you said before, insomnia can cause numerous problems. It's easy to understand how it can cause fatigue, and it even results in anxiety and depression. And as you mentioned, it increases the risk for many other health problems, such as heart disease, high blood pressure, diabetes, and even obesity. And of course, the restless leg patients, which may comprise up to 10% of the adult population, has even higher incidences of insomnia, and therefore have higher risk for those associated medical problems.
What is restless leg syndrome?
Well, restless leg syndrome is a neurological, sensory, and motor disorder that causes patients to have these very uncomfortable, unpleasant sensations in their legs associated with this irresistible urge to move their legs. It occurs when the patient is at rest, and the only way to get relief is by rubbing their legs, moving their legs, or getting out of bed and walking. And because it occurs maximally at bedtime, you can see how this easily disrupts sleeps and causes lots of insomnia. And of course, since RLS is a chronic condition that tends to worsen with time, these patients can suffer from years of sleep deprivation until they get appropriate treatment.
Well, what can RLS patients do to get a good night's sleep then?
Well, until recently, the only really effective choices were medications. And of course, the issue with medications is they don't work for everybody, and a lot of patients experience significant side effects from any drug or medical treatment. So it's great that we have a recently approved new option, the Relaxis pad, which is the first FDA-approved non-pill or non-drug treatment for restless legs.
And how does it work?
Well, this is a medical device that is a vibration pad controlled by the patient. They can adjust how much vibration they want. They put it under their legs when they go to sleep. And if they get an RLS attack, which again typically occurs while in bed, they can simply turn the pad on and get relief and get back to sleep without having to rub their legs, get out of bed and walk, which they sometimes have to do several times. So this is really a game changer if it works for the patient, because they can just stay in their bed and go right back to sleep.
Now, how long has this been out?
Well, it was FDA approved somewhere in the past year, so it's still relatively new. It was actually a device that was created by a doctor who himself had restless legs, and he was searching for a non-pill treatment that would help him. So it's fairly recent, but we have a couple of studies that have shown that it's very effective for helping sleep in restless leg patients. And in my practice, I've had many patients find that it helps relieve their restless leg symptoms and improve their sleep quite significantly.
And really quickly, do you have to have a prescription to get this device?
Yes, this is a prescription-only device, so you have to speak to your own doctor about being able to get a prescription. And of course, if your doctor thinks it's appropriate, they can write a prescription for you, and you should be able to obtain this device, which is available nationwide by many different distributors.
It's a great option for people who don't want to take drugs. Thank you so much, doctor.
Oh, you're very welcome.
Take sleep and RLS into your own hands. To find out more about Relaxis, head to the website on your screen. Sean?